Well, I'm happy to visit today with Dr. Gavin Macgregor-Skinner, the Senior Director of GBAC, the Global Biorisk Advisory Council, which is a division of ISSA. Today, we're going to talk about an interesting subject people might have seen in the news. It's about the CDC putting out an official health advisory. What is that, Gavin?
Yeah, this is interesting for everyone within the clean industry to take note of. The CDC, or the Centers for Disease Control and Prevention, puts out no more than 10 of these health advisories every year. This is an official health advisory. It provides important information. And the important information, this one that came out on June the 10th, Jeff, was there's an increase in detection in laboratories of respiratory syncytial virus. This activity now is across the southern United States. It's very important because this virus usually makes people sick during the cold winter months, and it's very, very unusual to see this virus circulating and making people sick in 14 US states in the month of June.
So what is RSV?
Well, respiratory syncytial virus, we call it RSV. It's an envelope RNA virus, so it's one of the easiest of all the germs to inactivate or kill. As CDC states in the advisory, it spreads via respiratory droplets, so when a person coughs, sneezes, or talks. But more importantly, the CDC has stated in this advisory, it spreads through direct contact with a contaminated surface. So these are these areas, these high-touch surfaces we talk about at ISSA and GBAC. Now, we know CDC also says it survives on hands for up to 30 minutes, and it's been found to be infectious on those hard, non-porous surfaces, those high-touch surfaces, for up to 8 hours.
Okay, so bottom line, what is the CDC telling us to do?
This is really important because the CDC is telling everyone to continue to wash your hands with soap and water. But they're also telling you, Jeff, that if you don't have soap and water, use a hand sanitizer. But more importantly, you need to clean and disinfect those surfaces that we touched off, and those high-touch surfaces, using disinfectants like, the EPA list N disinfectants that we use for SARS-CoV-2 virus that causes COVID-19 will work against this RSV, this envelope virus. But they're also telling us, it's more important to focus on these areas that we touch often, but they're also telling doctors that if you see increased activity of respiratory infections, it causes coughs and sneezes and headaches, and you test negative for COVID-19, then doctors and nurses should test you for RSV. But they're also telling everyone, and this is a reminder, Jeff, that if you're not feeling well, if you have symptoms, then you don't go to work and you stay away from other people so you don't spread the disease. You wash your hands and you clean and disinfect surfaces. Because this is so unusual for RSV to be circulating out of these cold winter months, this is the month of June, and we're in the south. It's most likely spreading in indoor spaces, those indoor spaces with air conditioning where we're seeing some crowding as we see the COVID-19 regulations become more relaxed. But more importantly, people should understand that RSV is the most common cause of bronchiolitis or pneumonia in children under 1 year of age. So most of us will get RSV virus and we might get some mild cold symptoms, a mild chest fever. It's not going to put us into hospital. But for kids under 1 year of age, yes, it does. And also for those adults 65 years and older. So CDC has stated in this advisory, each year in the United States, RSV leads to 58,000 hospitalizations with up to 500 deaths among children under the age of 5. And 177 hospitalizations and 14,000 deaths with adults over the age of 5, and especially amongst those adults with underlying medical conditions. So really important, we protect the older age group over 65, the younger kids under age of 5, and we all do the right thing, wash our hands, clean and disinfect surfaces.